My name is Carmine Capecci. I'm from Indiana. It was very difficult to drive. It was difficult to go to work. It was difficult to be with my family and go places. Very frustrating because the doctors I went to knew no way to help me. They said if you had PHN, there was no cure. You just had to learn to live with it and take narcotics. PBM therapy, a little bit of acupuncture. I did have 2 nerve blocks and a host of topical medications.
Her chronic groin pain and her abdominal pain and her flank pain seemed to be due to a case of shingles that had occurred a number of years ago and then left her with chronic pain afterwards. She had pain that kind of started on her flank and wrapped around a little bit toward her back and also down toward her groin. The area of her pain seemed to involve what we call the iliohypogastric and the ilioinguinal nerves. She was delighted. She didn't have any pain. And she said, "When can we do surgery?" We disconnected those nerves from the source of the pain, which according to some more recent research isn't actually the nerve root, which is the classical teaching, because that's where the virus that causes shingles lives. It lives in the nerve root right next to the spinal cord. There's more recent research which suggests that the problem is actually not at the nerve root, but where the nerve and the skin connect, and that there's either damage to the skin where this nerve and the skin connect, or damage to the nerve where the nerve and the skin connect, or damage to both where they connect to each other. She came back today for her follow-up. She had surgery a few days ago and she said she feels fantastic.
Find ways to educate yourself, whether it's on the internet, whether you try YouTube, which I highly suggest.
To my knowledge, there's only a small number of us here in the United States that offer permanent surgical solutions for postherpetic neuralgia. There's myself, Dr. David Brown, Dr. Eric Williams, and Dr. Tim Tolstrup. Ultimately, one of my goals is to have, instead of 4 of us treating these patients, maybe 10 years from now, there's 4,000 of us. Maybe 20 years from now, there's 40,000 of us.
My experience with Dr. Aguila has just been absolutely wonderful. He's a very caring and I call him a genius doctor, and the staff here is awesome. I feel like if you take it upon yourself to take the chance and you want to come out to Nebraska, I highly recommend it.